Good evening. My name is Crystal Reyes. I'm here to share with you the grant proposal that I worked on to add a substance use treatment program within the continuum of care services currently offered by Neighborhood Services Organization. NSO is a 5013C located in Detroit, Michigan. Established in 1955, their mission statement is to strengthen communities through bold outreach services and holistic programs for vulnerable populations, changing lives one person at a time. NSO aims to provide compassionate and professional services through impacting countless children, youth, adults, seniors, families, and communities. According to a finding published in September of 2018 by SAMHSA, the Substance Abuse and Mental Health Services Administration, approximately 3.4 million young adults ages 18 to 25 had an alcohol use disorder in 2017. Another 10.6 million adults over the age of 26 met diagnostic criteria for alcohol use disorder. Another study funded by the Michigan Health Endowment Fund noted that 638,000 Michiganders were experiencing a substance abuse disorder, yet only 20% received treatment, with more than 500,000 people left untreated. In Wayne County, where Detroit is located, there is more than an 84% gap in treatment services. 70% of those persons are African American. The goal of this project is to increase access to substance use and co-occurring behavioral health treatment by implementing an addiction treatment program within the NSO Services Organization. This year alone, NSO has seen a 244% increase in the number of overdose deaths within one program. We know that not every individual with a substance use disorder will want help, and not every overdose will be prevented. The objective of the program is to provide individuals with an accurate and timely assessment of substance abuse, offer evidence-based interventions, and deliver multiple layers of recovery support. NSO aims to provide these services within the current fee-for-service infrastructure and to increase access to substance abuse treatment to Michigan residents regardless of their ability to pay. The plan of work entails creating a work group to begin the development of the program, identifying payers, commercial, Medicaid, Medicare, and billing codes, reorganizing and realigning the NSO current policies to include substance abuse language, and then to provide a seamless referral process for all providers within NSO. Finally, we will record and track all outcomes. The evaluation will include multiple layers, with the final layer being accreditation by the Commission of Accreditation and Rehabilitation Facilities. I would like to thank Dr. Sheff, NSO, CEO Linda Little, and COO DeJuan Smith for supporting my time through this project. Thank you.